Hello friends, dental scaling is routinely performed to help patients with gum disease and excessive plaque buildup. While standard cleaning will address the surface of the tooth, scaling goes much deeper. If your dentist suggests dental scaling and root planning for your teeth, it's helpful to know what this means so you can prepare for what's ahead. So today I am going to tell what is dental scaling and when is dental scaling necessary. So I am Dr. Poonam and you are watching my channel Smile Openly. First, understanding scaling. Scaling is a common dental procedure for patients with gum disease. This is a type of dental cleaning that reaches below the gum line to remove plaque buildup. The process of scaling and root planning the teeth is often referred to as a deep cleaning. This treatment goes beyond the general cleaning that you receive with your regular checkup and annual visit. Now, when is dental scaling necessary? Everyone experiences some form of plaque buildup. The saliva, bacteria, and proteins in your mouth form a thin layer that covers your teeth at almost all times. When you eat, tiny particles, acids, and sugars from the food stick to this film, creating a buildup on the teeth known as plaque. The bacteria that lives in this plaque can cause gum disease and tooth decay. Brushing, flossing, and regular dental cleanings will help remove the plaque and prevent more serious problems. If you have healthy gums, the tissue will fit tightly around the tooth and keep plaque out. However, if gum disease begins to form, this tissue will loosen. Healthy gums attach to the tooth just 1 to 3 millimeters below the gum line. With gum disease, you will begin to develop deeper pockets. These can fill with plaque, worsening your problems and causing symptoms like bad breath. If you have pockets of 4 millimeters or more, your dentist will probably recommend dental scaling to remove the plaque beneath the gum line and help treat the gum disease. Now, what is the procedures for scaling and root planning? Dental scaling involves the careful removal of plaque bacteria from the tooth surface just below the gum line. There are two basic methods for scaling teeth. If your dentist uses handheld instrument, he or she will scrape plaque from the tooth using a metal tool known as a dental scaler and cure it. The dentist will insert this thin tool beneath the gum line to assess plaque your toothbrush can't reach. Alternately, your dentist may choose an ultrasonic instrument to scale your teeth. This features a vibrating metal tip combined with a cool water spray. The tip chips starter away as the water flushes out the pockets. Dental scaling is typically followed by a procedure known as root planning. Root planning reaches deeper to address the surface of the tooth root. This is done in the same manner as scaling. Root planning smooths the surface of the root so the gums can reattach properly. What does scaling feel like? Now I am going to tell what does scaling feel like. Dental scaling can be uncomfortable, particularly if you have sensitive gums. Your dentist may offer a local anesthetic to numb your gum tissue and make the procedure more comfortable. Speak with your dental care provider about your options for desensitizing the area if you are concerned about pain or discomfort during the process. Dental scaling can take several visits, each one addressing a different portion of the mouth. Some dentists divide the mouth into four quadrants, while others will perform dental scaling in two halves. If you are nervous about the process, ask your dentist if you can schedule your scaling for a single visit. Though this isn't an option for all cases, it may be available. If you have only moderate gum disease and are willing to sit for a lengthy procedure. Now, what to expect afterwards? Your mouth may feel sore and sensitive after your dental scaling and root planning. Some patients experience swelling or bleeding for a few days following the procedure. Your dentist may suggest a desensitizing toothpaste to help ease this discomfort. You might get a prescription mouthwash to use after the procedure as well to help keep the gums clean. It's crucial that you have proper brushing and flossing procedure after scaling to stop plaque from forming again in the same area. Your dentist should schedule a second a visit after your dental scaling to examine the gums. Measure the depth of your gum pockets and make sure your mouth is healing properly. If the gum pockets have gotten deeper since your scaling, you may need to explore additional treatment options to help you maintain a Healthy smile. Dental scaling is a very common treatment for patients with gum disease. Nearly half of American adults have gum disease, so you are not alone if your dentist recommends this procedure. Scheduling dental scaling as needed can help you battle unseen plaque and maintain a cleaner mouth. If your dentist indicates that you need a deep cleaning, don't hesitate to schedule this appointment. The result is a fresher smile that you are sure to enjoy. If you like my video, please like, share and subscribe. If you have any query about dental related problem, dental scaling related problem, you can ask me by commenting through comment box. Thank you.